Hey guys, welcome back to my channel. Today I'm doing something that I haven't done in a little while. I wanted to give you guys an update, just kind of a quick update of where I'm at after my weight loss surgery, after my gastric bypass surgery. So if you're new to my channel, if you've never seen any of my weight loss surgery videos, I had gastric bypass surgery, or the Roux-en-Y surgery, on August 28th, 2017. So I think that makes me about 15 months post-op. And I had my surgery in Knoxville, Tennessee with Dr. Boyce at New Life Center for Bariatrics, and they were absolutely wonderful. So since then, I'll give you all my statistics. My highest weight was 231 pounds. I am 5'1". I'm not sure if I've mentioned that in the past, but I'm 5'1", so I'm pretty short. And my lowest weight last week was, I think it was 128.6. And my goal weight has just always been randomly 125 pounds. My surgeon didn't come up with that for me. In fact, my dietitian at one of my last visits with her said that she wouldn't go much lower than that. I feel like I could go lower than that, but my goal was 125. I really have no goal time to reach that. I'm pretty happy where I'm at right now, which is pretty close. It's usually around 130. You know, of course, the scale can fluctuate a tiny bit. So I'm usually right around 130. And I'm pretty happy. I'm pretty thrilled with where I'm at. So I've officially lost a little bit more than 100 pounds. The scale, like I said, is still slowly going down, but I've kind of reached that point where I'm not really trying very hard. I'm just doing my best to eat make fairly healthy choices throughout every day. Life has just sort of become normal, and I'm just kind of eating what I want in a good way, in a healthier way, and of course much smaller portion sizes. But if I want a piece of Halloween candy, I would get a piece of Halloween candy. So I'm not trying not to overdo it, but I do eat some junk every now and then, but mostly I do really well. So I think that's why the scale is still going down. But I'll be honest, I am a bad patient on one hand, because I haven't been tracking my food a whole lot lately, but I think that's because I stick to not the same thing every day, but similar food items every day. So a lot of times for breakfast, I'll just have my protein shake. And then for lunch, I'll have just lunch meat and rolled up or something, little lunch meat rolls and a cheese stick, or, maybe some pretzels. So I'm eating pretty similar things every day. So that's why I don't always track it, because it's pretty much the same thing. And then for dinner, I'll make sure to eat my protein first and then have some vegetables. But it just depends. But I could definitely do better there. I could definitely do a better job of tracking my food. I need to get back on track with that. But, my diet is just pretty similar every day. So far it seems to be working well for me. I did have my last official meeting with my surgeon's office with the dietitian. I luckily got to do it over the phone because they're in Knoxville, and I've recently moved to the Nashville, Tennessee area. So I didn't have to travel back there, which was nice. So I got to do that appointment over the phone, and she was very nice and very helpful, but we really didn't come up with a huge game plan because I wasn't at my goal weight yet. So she did say when I get to my goal weight, and if I want to try that, she basically gave me the instructions that I definitely need to be tracking my food. And once I reach my goal weight, to just add about 250 calories to what I'm typically eating. And then if I'm still losing weight, to add another 250 calories. So we're just going to kind of play around with it. So she didn't really give me a straight answer of, oh, when you get to maintenance, this is how many calories and this is how many carbs and proteins, protein you should be looking for. She gave me a rough estimate, and she just said, of course, to just kind of play around with it a little bit and to watch my weight, to weigh about once a week. And if I need her, I can call her anytime, which is so nice. They're very helpful at that practice. So I don't really have a great answer for you guys of what I'm going to stick with in maintenance, because technically I'm not in maintenance yet. I'm still really slowly losing. So once I reach that point, I'll definitely give you an update. But I do have my first, I don't even know if you would consider this a complication from the surgery, but I think us as weight loss patients are at a higher risk of having this problem. So I do think it is related to the surgery. But I had a few months ago, I had some pain in my stomach, and I thought it was more kind of related to trapped gas pain. So I took some Gas X and it just wasn't going away, and it was there 24 hours later. So I went ahead and called the surgeon, and it was really bad stomach pain. I was having to lay in bed. I was so worried that it was either my appendix or diverticulitis or something like that. And it was right before we moved over here to Nashville. And it was like the weekend before we were about to move, and I had so much stuff to do, but I was in such bad pain, I had to stay in the bed. So I called the practice, I called my nurse, and she instructed me to take Prilosec over the weekend, which I did, and it helped a lot. So I kind of have taken it off and on, but the pain was getting worse for months. So I called, and they did recommend that I go see a stomach specialist here. And so I just recently saw her this past week. She was super nice. And she agrees that she thinks it's a stomach ulcer. But because I'm able to treat it with over-the-counter Prilosec, and it is completely controlling my symptoms, and as long as I watch my diet, I've completely cut out, I don't really drink much alcohol, but I definitely have a glass of wine every now and then. So I've completely cut that out, which was fine. I completely cut coffee out, which was not fine. That's like my number one treat every day after this surgery. Like, instead of getting up and getting a piece of candy, I'll say, no, I'll just have a cup of coffee and just enjoy that. And so that's, I don't know, that's been really hard, but I've kind of slowly started easing coffee back in just a little bit, and I seem to be doing fine. So I'm allowing myself some coffee, but no spicy foods, no acidic foods. I'm trying to follow a fairly strict diet to help that ulcer to heal. So I'm doing that along with the over-the-counter Prilosec seems to be helping. And she said because I'm able to control it with that lower dose Prilosec, that it probably isn't too serious. So she's letting me wait. She does want me to do the upper scope or the endoscopy. So she said I could wait until January to do that. And so I'm going to probably do that towards the end of January, and we'll see where we're at with that. So, but I would consider that my first real complication after the surgery, which I don't know, I'm pretty blessed to say that I haven't had any complications except for some hair loss, that's for sure. But that's kind of just an expected side effect, I would say. So other than all this time in these 15 months, other than the stomach ulcer now and my hair loss, those are the two things that I would have to say were kind of the downsides of the surgery. Other than that, this is the best thing I have ever done. Other than choosing my husband and having my girls, this is the best decision I have ever made. So if you are watching this and you are pre-op, or you're just considering doing this surgery, you know, I'm not going to tell you that you're not going to have complications, and it's not going to be a hard road, because it is not easy, especially in the beginning, but it gets so much easier. It just kind of fades into just normal life again, and you can still eat pretty much whatever you want to eat, but just tiny little bites of things. If we order a dessert at a restaurant, I'm going to have a couple bites of it. I'm not going to eat the whole dessert myself. Or if we have pizza, I can have some pizza. I just am not going to eat 4 pieces of it, So everything in moderation. That's how I live after the surgery. I know a lot of people are very strict with their diet, understandably, and I do try. I don't want y'all thinking that I just eat whatever I want. Now that I'm thinner, I'm gonna stay that way forever. I don't look at it that way, don't get me wrong. I definitely work hard every day to try to stay on track, but I also enjoy myself, and I don't think there's anything wrong with that. So just so you know, life gets back to normal. If you are going through, especially those first couple weeks after surgery, and you're like, why did I do this? You will get back to normal. You really will. And I couldn't be happier. I think I said this, my clothing size and things like that, in the last video, but most of the shirts that I get are extra smalls or smalls. I mean, the pants smalls, I think I'm in a size 4 jeans, and I bet when I was in 3rd grade, I couldn't have fit in a size 4 jeans. I've just always been a chubby little girl. And so this is incredible. I'm loving shopping. I mean, I always liked shopping before, but I love going shopping and grabbing and everything I feel confident in. So if you were considering this, just know that it is the best decision I've ever made. So I hope this video has helped. I love hearing these updates to see where people are at, so many months down the road. So as soon as I meet my goal weight and I try to figure out my maintenance diet and kind of where I'm at calorie and carb and protein and fat and all that stuff wise, I'll try to give you guys an update. But for now, I don't have a whole lot to report on that. I hope you guys have enjoyed this video. Let me know down below. I know a couple people have commented, and I always love to hear, especially where you guys are at in your journey. I know someone recently commented and said that they are going to have Dr. Williams, who is my surgeon's partner. So that's always so exciting. So let me know down below where you guys are at in your journey, anything that's come up. I just love hearing about everybody's journeys. And I will look forward to seeing you soon. I will try to do a video, like I said, as soon as I think the next video I'll do is when I'm in maintenance, and I'll update you on my diet, and I'll also let you know if anything comes up about my stomach ulcer. But you guys have a great rest of the day. Thank you so much for watching. Don't forget to subscribe if you haven't already, and I'll see you soon. Bye.